I'm Estefanía and I work at the Universidad Austral de Chile in the south of my country, in the city named Valdivia. My talk is about the Chilean model of screening. With this view of the world map, I'll invite you to know better the reality of my country, Chile. We are one of 13 countries in South America, located on the lower Pacific shore of the continent. The Chilean population in 2020 was 19 million inhabitants, and in that year, 210,000 kids were born. The incidence of TDAH in Chilean population is 3.9%. That means each year, 8,400 children will have the disease in all its presentations. The incidence of dislocated hips is around 0.1 to 0.2%. Active search for hip dysplasia is needed because this disability can be avoided with low-cost health policies. Developmental hip dysplasia has a wide spectrum of pathologies, from mild hip dysplasia to hip dislocation. Everybody knows that an early diagnosis will take you to a high success with orthopedic treatment or minor procedure. So, any doubt about screening? In Chile, since 1970, the Orthopedic Surgeon Society was aware of that, so they taught in every medicine school that DDH must be searched actively. So nurses, doctors, and any health provider knows that it's a big burden not to diagnose DDH on time. Nowadays, we look for DDH with ultrasound at first month of life or radiograph at 3 months of age. These images are insured by law, and it's called Explicit Warranties in Health. This law was enacted on 2004 and started with DDH on 2009. This law protects every newborn in the country, so it's universal. The age of 3 months was chosen to obtain the screening radiograph for hip dysplasia, as it's the earliest moment that allows for assessment of a mild dysplasia or unstable hip with this method, given the acetabular ossification process. An ultrasound at 4 weeks of age to avoid repetition of the examination due to physiological immaturity. The law not only provides to any newborn in Chile the chance to have good images from their hips, in case you have DDH, also provides the treatment and the follow-up by an orthopedic surgeon. The general objectives of this law is to guide the early detection and treatment of DDH in infants, particularly those with risk factors. Also to improve the functional ability and long-term quality of life of people with dysplasia, and also to reduce the incidence of degenerative joint disease, pain, and mobility limitations of the affected hips in these patients. How can we measure this success? The way you can prove that your health policies are working is by measuring the rate of hip major procedures like open reduction, pelvic osteotomies, and femoral osteotomies. In this study that we published in 2021, we investigate the results of the DDH screening program in Chile. Patients born between 2010 and 2015 were evaluated during their first 5 years of life. The number of major procedures like open reduction, pelvic osteotomy, femoral osteotomy, and the numbers of minor procedures like close reduction, hip spica casting, adductor tenotomy. During the study period were compared, and ages at the first procedure and patient sex distribution were analyzed. The incidence of major procedures was 0.18 per 1,000 newborns. Several studies show the incidence of major surgical procedure with clinical surveillance, and our incidence is 4 times lower, but we double the incidence if we compare our results with universal ultrasound screening programs. We consider that the Chilean national TDH screening program is appropriated for use in regions with healthcare system with limited resources, that the screening procedure is reproducible, and that it yields substantial public health benefits. In the 21st century, with all the advances in health and technology, we cannot accept cases of dysplasia not treated in a timely manner, or a limping child that becomes a limping adult. Our goal throughout Latin America society is to at least have a universal screening program, timely, with good quality, and affordable. Thank you for your attention, and thank you for the invitation. All these symposia and courses improves our patients' lives.